At this point, I'd like to talk about cartilage and cartilage injuries. First of all, what does a cartilage do? Okay, cartilage aids friction-free movement at the knee joint and provides some form of shock absorption. It's a good example there. Okay, we consider the knee joint in this particular example. Now, the cartilage can tear if the knee is twisted excessively. This, by focusing on the knee joint, this is a very common football injury. Often caused when players change direction quickly. Okay, I'm sure you've heard the term of ACL injury. This is something I'll cover in a little bit more detail. A cartilage tear is a serious injury. The knee will become very, very painful. It may lock and it will swell. Okay. Now, immediately an ice pack should be applied, and this can reduce swelling, but surgery is sometimes needed to repair the damaged cartilage. Medical treatment has improved dramatically in recent years. Okay. When we consider problems to the ACL or anterior cruciate ligament, unfortunately in the past it's ended many careers of many talented footballers. Okay. The person I'm going to concentrate for this lecture is a gentleman I'm sure who needs no introduction, perhaps more famous as a manager, an incredibly successful manager, and I'm sure you'll all agree, a great character in the game. Okay, Brian Clough. Now, Brian Clough, okay, as well as being a fantastic manager, a TV personality at some point, and really an icon of the British game, he was also an incredibly successful footballer. He was a very talented striker. Unfortunately, Clough's career was ended at the age of 29 by an ACL injury. Let's just consider some of his stats, okay? He'd scored 197 goals in 213 games playing for Middlesbrough. Quite a good record, okay? And I think as anybody who's seen Brian Clough in action on TV, he was quite proud of himself. He wasn't what you'd call a reserved person, okay? And he would talk about he was one of the greatest goal scorers of his time. But unfortunately, his career ended at Sunderland, okay? Some more stats for you? Well, he scored 54 goals in 61 appearances for Sunderland. That's a fantastic record. He was actually injured. Yeah, he suffered an ACL injury as a result of a 1v1 with a goalkeeper. Now, in the modern game, there's a very high chance that he could have continued to play with improved medical support and aftercare and surgery. I'd like to consider now then how we might deal with soft tissue injuries. A task for you, just to get yourself back on track. There's a well-known acronym we often use to describe the correct procedure to deal with soft tissue injuries. Now, if you've completed an FA or FAW, Emergency Aid Award, you will have certainly encountered this term. What is it? I'd like you to discuss this and share with the group via the wiki, okay? There are slight variations and I'll accept that, but let's just review our knowledge then in this case. The acronym I asked for, well, in this case I'm going to focus on RICE. Whenever there's an injury to bones, joints, ligaments, muscles or tendons, blood vessels will become damaged, okay? That's part and parcel of that injury. Broken blood vessels mean that blood leaks into tissues around that injury location. And this will lead to swelling, bruising, inflammation, and often intense pain. In order to combat the effects of this, we're advised to follow the RICE method of treatment. We need to rest, we need to apply ice, we need to apply compression, and we need to elevate the injury. I mentioned earlier about the common causes of sporting injury. I'd like to just retouch on those, please, okay? Overuse, stopping suddenly and twisting. This is quite common in football, particularly if we look at ACL injuries, as we've touched on. Also very common in American football, where those guys, they're huge, they move incredibly quickly for their size, the weight that they are carrying, and when they change direction quickly, it puts incredible forces, okay? Incredible stress on their knee joints. they see a lot of ACL damage there. Okay, falls, we know. Improper equipment, we've already touched on. Maybe your training shoes, your football boots, even goalposts, for example. Okay, if they aren't properly secured, if they aren't up to standard, that can cause a problem for our younger players in particular. A new or increased activity. When we start a new activity, okay, it's a novel movement for us. The movement patterns are different, and we often find ourselves feeling a little bit stiff afterwards, okay, or in a few days' time. This is called DOMS, the delayed onset of muscular soreness. We can, of course, if we don't take enough rest, risk their damage to the muscles, okay, and we can get some form of muscular injury there, some soft tissue damage. When we actually take part in a new activity as well, we're less accomplished. If I was to go skiing, okay, I've never skied before, I'm much more likely to fall over, aren't I, and have and suffer a hard tissue injury, a broken ankle, for example, or a fracture, as opposed to playing football in the park with my mates. We can also consider unilateral movements. What do I mean by this? Unilateral refers to only one side of the body. Repetitive movements all the time, okay? We know this can cause a problem. Poor technique. I certainly see this. I trained in a boxing gym for some time in terms of fitness. I didn't have a fight with anybody, just went along and hit the punch bags and hit the pads and so on. And I saw a friend of mine use poor technique when he was punching the pad and really damaged his wrist quite badly because he punched with his wrist like this, bent wrist. And the coach had told him quite clearly and shown him and demonstrated to punch with a straight wrist. Okay? So there's an example of bad technique causing an injury. Posture can also have an effect, particularly in terms of chronic injuries. Yeah? If you're playing hockey, for example, and you're bent over, that can lead to back problems. And you do see a lot of back problems with hockey players. Impact. We've talked about this one. Think back to Phil Babb. Remember that one? You probably won't forget that one. Also in other sports, getting hit with a hockey stick, rugby, contact with an opponent, American football, they hit each other with a helmet, ice hockey, they fight. We've seen this when we looked at aggression in psychology, okay? They hit each other, they punch each other, they hit each other with the sticks. These are all different types of and reasons why you can have a sporting injury within that way. Of course, they're breaking the rules there. We got outside the rules of the game. But I just want to use this as a chance for us to kind of quick review of everything we've covered so far, because there is a lot to cover in this section.